Good morning. My name is Andy Thomas. I'm Chief Clinical Officer here at the Ohio State University Wexner Medical Center. Would like to once again thank our members of the local and statewide media for joining us today on this COVID-19 media briefing. I'm joined today by three of my colleagues from the Ohio State Wexner Medical Center, Dr. Luan Fon, who's chair of the Department of Psychiatry and Behavioral Health, Crystal Tubbs, who's the Associate Director of Pharmacy for the Wexner Medical Center, and Dr. Nora Colburn, who's one of our infectious disease specialists and Medical Director of Clinical Epidemiology for the Ross Heart Hospital. Our goal this morning is to cover updates related to the COVID pandemic, and we're specifically going to be focusing some comments around the COVID-19 booster process and eligibility, as well as the mental health impact of the pandemic, as we've now crossed the 18-month mark since our first case here in Ohio. So before we start into the two topics for today, I wanted to just briefly share some data about where we are at this point with the pandemic around the state and here in the region. The screenshots you're seeing now are cases across the state of Ohio. The top left chart is cases since the beginning of the pandemic back in the spring of 2020. And the bottom right is just cases in the last 30 days. Each blue vertical bar are the number of cases that are identified and reported each day. And then the blue line is a 7-day moving average trend line. As you can see, in a slight bit of optimistic news, we've seen a decrease over the past 2 weeks in our daily case rate on a 7-day moving average. Obviously, there's variability throughout the week. But if you look back to about 2 weeks ago, we were just above 7,000 cases per day on the 7-day moving average. And we've gone down to, yesterday was just below 6,000. Today is right about 6,000 cases per day for the 7-day moving average. So much like we've seen in other states around the United States that were maybe 2 to 4 weeks ahead of us in the Delta variant, or other countries around the world, these things do tend to have a peak and then they start to come down. We are cautiously optimistic as a state that we might be at that peak. And as we've talked about in these briefings before, we then become cautiously optimistic that 2 to 3 weeks out from that peak, we may start to see some peak in hospitalizations for COVID-19. Knowing that people generally are not admitted on the same day they're diagnosed, they might be admitted 7 to 10 to 14 days later after they're diagnosed. So we've looked at this map in the past many times. When we refer to zone 2, we mean regions 4, 7, and 8 across the state. So those counties in central Ohio and the counties directly south of Columbus, and then those counties to the southeast of Columbus. What we see on this chart are the COVID census for zone 2. So that blue line is the count of active COVID patients each day in the hospital. The red line are the count of active COVID patients in our ICUs in the hospitals in zone 2, and the green line are patients on the ventilator in the hospitals in zone 2. And as you can see, about 10 days ago, we had a peak at over 1,000 cases in the zone. If you remember our worst day back in December, we were just over 1,200 cases. So at very, very high levels. But for the last 2 to 3 days, we have actually been under 1,000 patients in the hospital in the zone. We've seen peaks and valleys in terms of short-term trends in the past. I think if these trends were to continue for another 5 to 7 days, we might feel good that we are starting on the downside of this from a hospital census perspective. But as you can see, we still are at a point where 1 out of every 5 patients in a hospital in zone 2 for any reason are there because they have COVID. That's 1 out of every 5 patients in the hospital in zone 2 are in the hospital with active COVID. And 1 out of every 3 patients in an ICU bed, or 1 out of every 3 patients on a ventilator in a zone 2 hospital are there because they have COVID. So even though we may have peaked, and like I said, I think it's another probably 5 to 7 days before we can feel comfortable that this is a real trend, we still are at incredibly high rates of hospitalization from COVID-19. We are seeing now in the southwest part of the state somewhat similar trends, but the northeast and northern part of the state is actually probably a week or 2 behind yet in terms of hospitalization. Many of you have seen there are significant hospital capacity issues in the northern part of the state. One of our hospitals in the northern part of the state announced because of staffing shortages, they're closing 20% of their beds for the time being. that's putting a lot of pressure on other hospitals in that area, and the ability to manage the volume is still quite difficult. And last, I'll finish with just a couple of notes about vaccination. I think, once again, on a slightly optimistic note, we are, for those folks in Ohio that are over age 18, we've now crossed 65% of those being vaccinated. And as you can see in the red box there, we continue to be well above 80% of those over age 65 are vaccinated in terms of at least receiving their first dose. So we look forward to movement by the FDA and the CDC in the coming weeks for those children ages 5 or 6 to 11 that we expect to be approved here between now and the end of the calendar year to receive the COVID vaccine as well. And certainly we continue to encourage those in the 20, 30, and 40-year-old age groups that have a lower rate of vaccination now to still move forward with getting their first dose of vaccine. So with that, I'll close my comments, and we're going to turn to our two topics for today. Those topics are COVID vaccine booster doses, which are for those who've been vaccinated previously, as well as the mental health aspects of the COVID pandemic. And I'll remind our members of the press, if you have a question, please go ahead and raise your hand or put a note in the chat. And when we're done with our comments, we will get to your question. So we'll start with Dr. Fahn. Luan, you've been a psychiatrist now for many years. You're an expert certainly on behavioral health and trends in our society. Can you talk a little bit about the mental health impact of now that we're past the 18-month point in this pandemic and what we're seeing in terms of our patients?
Yeah, thank you very much, Dr. Thomas. Mental health has been a silent pandemic in our society long before COVID. So the statistics suggest that 1 in 5 Americans suffer from a mental illness in our country. The latest report from our own Centers for Disease Control and Prevention, the CDC, now suggests that 2 out of every 5 Americans are struggling with anxiety and depression. So we've doubled the number of Americans struggling in our society with real clinical symptoms of depression and anxiety. I think the other thing to note is that even if you don't have a clinical problem, surveys at the workplace, surveys across our community suggest that as half of us believe that we're languishing. Languishing meaning that even though we might not be struggling with depression, anxiety, or addiction, we just feel burnt out. We feel fatigued, we feel anxious, we feel uncertain. And these are kind of things that are really prevalent now because of COVID. Just because people were hoping for a light at the end of the tunnel, they don't see that light yet. And I think those kinds of things take an immense toll amongst our society. I think, the main message I would have is that you're not alone. If you're struggling, we know that you are. I don't know of anyone who doesn't have a family member or a friend who's also not struggling. So it's important to sort of be vigilant about the fact that you might be having a mental health challenge, that it's quite normal to feel this way, that many of us do feel this way, and that there are providers and treatments out there that are there to work. What I would encourage is to not to turn to things that are negative, not to turn to alcohol, bad habits that then make things even worse, to know that there are treatments out there, there are providers out there here for you, but to sort of normalize the fact that we're all really struggling emotionally and cognitively because of COVID.
Can you talk a little bit, Luan, about for healthcare workers specifically, the pressure that this puts on people, the moral distress of knowing there's a solution out there to keep a lot of these patients out of the hospital with the vaccine and people aren't getting it? Can you talk a little about how that is working these days?
Yeah, so more than before, we've begun to recognize that our healthcare providers, our doctors, our nurses, our OT and other kinds of therapists and technicians are at the front line. They're taking care of the sickest of the sick in our communities, especially people who come into the hospital now with COVID. I think what is the struggle that's in front of us is that despite all of us entering this field of healthcare, being really passionate and compassionate to take care of people, we also understand the fact that the disease, COVID, could have been prevented. And I think that makes it a struggle for many healthcare providers. In a very similar way, when we see people with cancer who smoke a lot, or people who get into a car accident who didn't put on a seatbelt, these are really fundamental things that we need as a medical center, as a health system, and as medical providers to say that there is a treatment out there to prevent you from getting COVID and certainly prevent you from developing bad consequences, bad physical health consequences from having COVID. And I think that's the struggle that our frontline workers have, where they sort of see an onslaught of people coming to the hospital quite sick and wonder whether there was something out there that could have prevented their demise in the first place. And I think it's hard. It's hard for our frontline workers to sort of struggle with that day in, day out, because they are here always to take care of the sickest of the sick, but they do struggle with this dilemma that's out there. And I think that we all want to be really, really clear that the science is very clear that you should get vaccinated, that vaccination is safe, and that vaccination protects your life and it protects the lives of those that you love right around you.
Thank you, Luan. That's well said. I'm going to turn to Dr. Colburn. Welcome, Nora. Obviously, in the past week and a half, we've heard a lot from the FDA and from the CDC about booster doses. Do you want to just comment a little bit on what's recommended, who's eligible, and really how the landscape has changed a little bit in the past week, especially for those who've had Pfizer, the Pfizer vaccine?
Thank you so much, Andy. Yeah, I'd be happy to. So I think it can be kind of confusing, and I think it's important to start with making sure we have the same language and definition. So several weeks ago, the FDA and CDC recommended a third dose for those who are immunocompromised. And we say third dose because these are meant for patients who may not have mounted an appropriate immune response to the first two doses of Pfizer or Moderna. And so we've been actually having that in play at OSU for several weeks now, actually. What just happened was that Pfizer took data to the FDA about a booster dose. So this would be an additional dose for folks who got Pfizer, showing that it could help increase antibody levels 6 months after their second dose. So the CDC reviewed it, and the recommendations are that patients 65 and older and patients who live in a long-term care facility or have certain chronic medical problems that put them at risk for severe disease are recommended to get a booster dose 6 months after their second dose of Pfizer. And patients who may have another risk of getting COVID, 18 to 49, or who may have an increased risk of exposure based on their job or where they live, may receive it. So it really, it's not mandatory, but they may receive it if they've perceived that risk benefit to be beneficial to them. Now, people ask me a lot about what about Moderna? What about Johnson & Johnson? And at this point, the CDC or the drug companies have submitted data or planning to submit data, and we really need to wait for the science and the experts to review the data the same way we've done it for every other recommendation. So I don't know exactly when that's going to come. I suspect it may be soon. And as soon as those recommendations come out, we will be well placed to act upon those.
Great. Thank you, Nora. That's great. Great summation of a really complex moving target over the past couple of weeks. Crystal, you've been leading our vaccine efforts here at the Medical Center with Ryan Haley from our ambulatory administrative group. The Schottenstein Center was great opportunity for our community to get vaccine back in the winter and spring. Can you talk a little bit about where we are at the Medical Center in terms of offering booster doses as well as still offering first doses?
Yeah, certainly, Dr. Thomas. Thank you. So as you mentioned, we certainly, along with many other health systems in town, had a mass vaccination strategy early on when the vaccine became available. But we've really pivoted our strategy a bit to really think about getting the vaccine as close to the patients as we can and incorporate it into their routine care. And so what I really mean is that we now have a myriad of different locations that offer COVID vaccines and really looking at first doses, second doses, third doses, and now boosters. And so many of our ambulatory care clinics and locations like Worthington, Upper Arlington, close to our East Hospital, all of those locations are offering the variety of COVID vaccines for our patients, as well as several of our different primary and specialty care clinics. So for example, if you're going to your physician for a routine physical or a checkup, or maybe going to the James cancer hospital for a routine cancer screening or checkup, you are able to get your vaccine at the same time you're having a routine appointment. So it was really important for us to think about making it as convenient as possible for our patients to access the vaccine. Along with that, there's a variety of hours. And so we really, in some of our sites, offer vaccine from as early as 7:30 in the morning up to 7 p.m. in the evening. So there's a lot of variety there in terms of trying to accommodate our patients' schedules.
You're making it convenient. Can you talk a little bit about what we're doing here on campus?
Yeah, certainly. So we have, obviously for our students, faculty, and staff, we have a location at our University Health Connection site right on our main campus, which is very convenient for both patients and our employees and students. We've also been working with the university at a site, the Jesse Owens North facility. So we've really been working with them to target and make vaccination easy for our students. And so that has been very well received. And we've really seen a nice uptick in vaccination in the past few weeks as students have returned to campus. And I think the last thing I'll share too, as patients are seeking perhaps to get a COVID vaccine, whether it be the primary series or a booster, in many of our locations, we are also offering the opportunity to get a flu vaccine at the same time. And so it can be kind of a one-stop shop for you. We'll probably administer that vaccine perhaps in 2 different arms. That's really the thing that we'll focus on, but it is safe for you as a patient to receive both the flu vaccine and a COVID vaccine at the same time.
Can you make a couple comments, Crystal, about how people can schedule?
Certainly. So several different ways. If you are an active patient in the system and have access to MyChart, you can easily schedule a vaccine through that electronic method at certainly your convenience. Another easy way to do that is to call our vaccine line, which is 614-688-VAX, VAXX, and one of our scheduling folks will help you get scheduled at a time and location that's convenient for you.
Great. Thank you so much, Crystal. We're going to turn now to some questions from our colleagues from the media. I believe our first question is WHIO, Candace Price.
So my first question, and thank you all for doing this morning, by the way, we really appreciate it. My first question is, if vaccines are doing their jobs, why do we need boosters? So if their jobs are to reduce hospitalizations, why are boosters necessary?
Nora, do you want to start?
Sure. So the concept of a booster in vaccines is actually not new. We need boosters for many different types of vaccines. Children get them quite a bit. Pneumococcal is an example of where we do boosters. So there was data that Pfizer submitted that the vaccine efficacy did wane over time. And I think there's a question, was it just time? Was it the Delta variant? Was a little bit of both. And so the idea is if you can give another boost to the immune system, another teaching moment, you can increase those antibodies and help increase that vaccine efficacy.
And I know, Nora, when I watched some of the ACIP hearings, I think it's been one of the most interesting parts of this whole process is how transparent the CDC and FDA have been with their committee meetings. But the vaccine efficacy reduction was really about more the breakthrough case concept. There wasn't really as much of a reduction in terms of hospitalization or death. It was really around getting the virus, not the most severe complications, correct?
Correct, because we still have excellent efficacy against keeping people out of the hospital and deaths. And I agree, it's a complicated situation because yes, we want people to be protected, but I think the other elephant in the room is that we really need people to get their first and second doses, because even a vaccine, like I'll give you an example. So the influenza vaccine, often in a typical year, the efficacy is 50%. I'm kind of happy if it's 50 to 60%. But if you get the vast majority of the population vaccinated, the effect is almost symbiotic, where you can protect people and improve mortality by doing that. So it's really important, especially we focus on these younger folks, of getting those vaccine rates up as much as we can.
Thank you. Candace, did you have a follow-up?
Yes, my follow-up would just be, is the university discussing at this time making booster shots mandatory?
At this point, based on the CDC recommendations, a couple of things. First of all, it's only for one vaccine. It's only for Pfizer. And personally, for me, I got Moderna. So I'm very much waiting for any sort of a recommendation to come out about Moderna. But we do know that there are a number of people that would not be eligible for a booster dose simply because of that. But when you look at the recommendations, as Dr. Colburn outlined them, if you're over 65, it's a pretty clear recommendation. If you live in a long-term care setting, pretty clear recommendation. If you're between 50 and 64 with certain high-risk medical conditions, pretty clear recommendation. The folks that are younger than that or that have maybe an occupational risk, those are more based on the risk benefit for any one individual. And it's not as, they're eligible to receive the booster dose, but it's not as clear cut of a recommendation to receive it. So at this point, there is no expectation that we would move towards a requirement for booster doses. That being said, science changes on all these things, and we do think at some point this may become some form of maybe an annual vaccination. So the jury, I think, is a little still out on the long term of how the vaccination pattern will look for this. But at this point, there's no expectation for the reasons I've given of having the third dose be required.
Thank you.
Okay, we have a question from Pete Grieve from Spectrum News.
Hello. Some Ohio hospitals have October 1st deadlines for staff to get the vaccine. I think Wexner's is October 15th. But are you expecting any impacts to, with already limited staffing available, are you expecting any impacts? And you maybe speak to progress towards getting Wexner's staff vaccinated?
At this point, I'll turn to Crystal if you want to talk about our capacity and next day availability and so forth.
Yes, certainly. So that's something we've been following very carefully. So not only recognizing that we had our mandate deadlines were approaching, but we knew at the same time we were going to be likely handling some of these booster patients. So we carefully monitor, and we, at this point, are scheduling. There's some of our sites that actually have next day availability to receive a vaccine. And so we have a plan in place to be able to bolster our ability to administer vaccines based on demand. So it's a careful balance of supply and demand. At the beginning of the pandemic, it was more supply and demand of the actual vaccine itself. But now it's more about demand for things like the booster and even new first doses, and then balancing that along with our staffing. So suffice it to say, we monitor that very carefully and have plans in place to escalate and add more availability if necessary.
I think, Pete, I would also add, there are well over 1,000 locations in the state where people can get vaccinated. It's not just our set of ambulatory clinics. So we are also, encouraging, whether it's our own patients or our own staff, to use retail pharmacies, health departments, other parts of the vaccine kind of enterprise for the state to get vaccinated. They qualify no matter where they go. So next question, Miles Harris from WSYX.
Good morning, guys. So a couple of questions here. Number one, with you guys being with Ohio State, there's obviously a lot of ties with football season being a factor. Has there been any conversations as far as trying to tie those two together with getting more of the state, I guess more in particular Columbus, vaccinated? When we talk about convenience and accessibility.
I guess I'm not sure I understand the question, Miles. The tying football season to what?
So obviously, when it comes to football season, sporting events, things of that nature, you're going to draw a crowd in. Is there any talks or conversations as far as trying to get more accessibility in regards to those to getting more vaccinated? I know we've talked about. Does that make sense? Sorry.
Certainly, yeah, it does. It does. I think certainly our messaging has been such, whether it's Gene Smith or Coach Day or messaging even during the game on the scoreboard, certainly encouraging people to be vaccinated. I will tell you, we've done some kind of point of event type vaccine programs in the past, whether it's community events or other things, even within the university. And I'll tell you, most people when they're coming to a football game aren't excited about rolling up their sleeve and waiting 15 minutes to get somewhere. What I will say, given the number of, for example, just in Franklin County, the number of locations that are within minutes of people's homes, I doubt that it's going to be at the football game that we're suddenly going to pique their interest and they're going to say, oh, wow, maybe I'll take this opportunity to get vaccinated. So we've basically found the uptake at those sorts of events to be quite low and are not currently planning to do that at the actual football game. That being said, what we've done both not just in Columbus or on campus, but around the state at our regional campuses is actually have what we're calling tailgate parties, where we do vaccine programs, oftentimes in conjunction with local pharmacies. Well, they'll come to our regional campuses, and we actually treat it as if it's kind of a tailgate, but it's a scheduled thing. It's separate from the actual football game, and even in some cases giving away free tickets to people that have come and gotten vaccinated and so forth. So I think that the question's a good one, and I think in some ways we thought there might be some benefit to doing that, but it's as we've had opportunities to do those sorts of events, they really haven't garnered a lot of people choosing that moment to get vaccinated.
Thank you. Another question though as well. I know, I think Dr. Colbert had mentioned it, talking about those that actually would be recommended for that booster shot. And I think one of the things that she mentioned was like if your job kind of had you at access to getting, can she break down exactly which jobs would apply to that?
Sure, Nora, you want to cover that?
Yeah, so the CDC recommendations were actually quite open-ended. So I think it really is in the patient's court to determine whether they feel that their job puts them at an occupational risk for exposure. So it really leaves it open-ended on purpose. It's not defined set.
The types of jobs that are listed on the CDC website, though, are healthcare personnel, educational staff, which would be teachers or other staff that work in schools. They talk about food service workers, kind of infrastructure workers. So think the power company, the gas company, et cetera. To Nora's point, it's a pretty broad definition, Miles, that unlike the original, say, January to April timeframe, when we were actually in a situation where we had too much demand and not enough supply, and we really needed to limit and have very strict definitions about who did or didn't get the vaccine. I think both from the federal government's perspective and certainly from a Ohio Department of Health's perspective, if people feel that they are at high risk because of their occupational exposure, getting it down to what your job title is may not define exactly what you do in any particular company or any particular school system, et cetera. So they've left it a little more open-ended, and they're calling that eligibility. So it may not be recommended for everyone in that group, but certainly based on your own personal risks and benefits, you would be eligible to get the vaccine. Does that answer your question?
It does, very much so. Thank you.
Great. Well, this has been a great exchange. We appreciate everyone's attendance from the media today. And I really want to thank Dr. Fawn, Dr. Colburn, and Dr. Tubbs for her participation today. The group is outstanding partners for all of us at the medical center. And once again, we thank the local media for doing everything you can to get good information out to the public. Thank you so much. We'll look forward to seeing you again soon. Take care.